Good day, friends of Buzzy. So today is April 13th, the day before my birthday. I will be 51 tomorrow. Thank you very much. No presents, please. But today we are going to be giving presents to one particular group of pain management advocates. And we're going to talk a little bit about some interesting COVID stuff like we often do. Today we're going to talk about why there was such a shortage of masks and what we may do about it in the future that's going to change everything with this. And then we're going to talk a little bit about some of the steps and products that are coming up for treatments and rationales behind them. And then we'll talk, of course, about our pain and focus after we dispense with the fear part. So first of all, let's talk about presents. And so if you are at Cook Children's, you're going to be getting the cute little Buzzy Help present in our lovely pin. And so it turns out that Cook Children's is one of the places University of Michigan, Children's Healthcare Philadelphia, CHLA. It's one of the places where we have a lot of child life people. And so if you look here, how many people does Cook Children's have? Well, they first of all have Artie Gandhi, who is the doctor who is heading their pain practice. And so she and Whitney Brosey have got together an amazing plan for a whole lot of patients who have pain, whether it is from surgery, whether it's from the actual procedures like child life people work with. So Dr. Gandhi and Ms. Nurse, Dr. Brosey, I don't know, we will be sending a whole smorgasbord of Buzzy Hero pins heading your way. So thank you for being our Buzzy Heroes of the week, I suppose. So now let's talk a little bit about some interesting COVID stuff. So why are we so hard up for N95 masks? I will tell you, it is because of climate change. Why is it because of climate change? Well, what happened at the end of last year in Australia? The massive forest fires that were in Australia caused them to order almost all of the world's supply of N95 masks for a couple months in a row last fall when they were having terrible forest fires. Then China got the COVID in February and January, and both of those months they ordered just about a full month's supply for the whole world. So the forest fires ate up all of the additional masks that were available, and then China used up most of the additional inventory that normally would have been restocking because they needed the masks themselves. So because of the propensity for forest fires, that's why. Now, that actually has something that's helpful, particularly in California, because businesses in California, if they have more than X number of people, they also have to stock N95 masks for forest fires. So that's why Facebook was able to give away 2 million masks, because they have to prepare for forest fires and all of the smoke and particulate that an N95 mask will stop. And thus there were extra stockpiles that a lot of places there had to help lessen the burden of the need in California for N95 masks. So I thought that was a very interesting thing. Other interesting things that are going along with coronavirus are that there is an ultraviolet light machine. You can call it the death ray or the death lance, but it does UVC. So you may have heard that if you have to go to the grocery store and you're getting a cart, you want to get a cart that's been sitting outside in the sun, because those carts are exposed to ultraviolet light, which kills viruses and bacteria. Turns out there is a particular frequency of ultraviolet light called UVC rays, which are particularly deadly to viruses and bacteria, also your eyes and people. So you can't do it while people are around, but there's a company making these, and it does kill 99.9% of viruses, including coronavirus types. So to disinfect with a blinky thing death ray sounds like it's something that may become part of our culture. You know, between when you get off the airplane and the people get on to pick up the peanut wrappers, do they do peanuts? The almond wrappers. Between that cleaning, there may be a full plain blinky thing, because these little boxes that are about this big can blinky thing 8 feet in distance. So you're still going to have areas where there's shadow that it doesn't kill the viruses. So you'll probably have to, I don't know, maybe it'll be mirrors put around. But anyway, that's one thing that is being investigated and is likely to be part of what we're going to see coming up, you know, for the post-COVID world. Another thing that is interesting that's happening is that the National Institutes of Health has an ongoing COVID treatment randomized controlled trial setup. So right now there are about 75 different trials that are happening in treatment in the ICU and in prevention. So one thing that has been done before for the just general upper respiratory infections is cleaning out the nares, like with neti pot, that type thing. But the interesting thing for COVID is that because it takes so long and because it's sitting around up in your nasal passages for a while, there may be a place for different kinds of nasal rinses that have better ability to either kill viruses, that have a better ability to increase the pH to make your nose better able to protect itself against being infected. So none of these things are specifically tested for COVID yet, but there are trials of hypersaline solution for upper respiratory infections. So those are the kind of things that are part of this huge 75 trial group. And the National Institutes of Health is coordinating all of these at centers of excellence. So while the vaccine issue is going to be of ways in the future, the nice thing is there are already a lot of ongoing trials that are going to let us have something that can be helpful before we get to a place where there's a vaccine, if we have one. One way that as places start to open and as we figure out how to do the balancing act was discussed over the weekend by Tom Frieden. So Tom Frieden was head of CDC, and now he is head of a group in New York still with public health. And so his concept is that we are going to have a testing army. So have a group of someplace between 3,000 and 4,000 people that are going around randomly testing, because the only way to make sure that it doesn't spread again is to test and isolate and quarantine, and we have to have good tests. So this means that probably having frequent testing everywhere is going to be necessary for us to go on a cruise again, for us to go back to college, for us to be in a place where there are a lot of people around. Some people are adding the additional concept that we have hospital capacity risk tranches, they're called, but levels of young people may get sick and may get infected, but they're much less likely to need an ICU and a ventilator. Whereas older people, just because of collateral circulation, because of exposure, because of potential increased immune response, maybe they've been exposed to something similar, whatever the reason ends up being, older people are more likely to use hospital capacity. So it is likely that we'll end up with some kind of, we're at code green, we're at code yellow, we're at code orange, but a place where certain people are in risk categories and they can go out and circulate. But if you're in these other risk categories, then you need to not go to the grocery, you need to stay home, you need to wait, because we've got a 2-week period between when people get it and when the hospitals get overwhelmed. And so these can be calibrated for different kinds of environments. So all of these are speculative at this point, but it is very likely that we will have testing be a significant part of the way we move forward. But with this testing, if we have treatments that are fairly simple, like I told you about the Iceland trial where they're doing a gargle or a spray in the mouth of an antimicrobial, antiviral, and having it squirt up the nose, if we have things that if you do test positive, you can make your likelihood of needing to go to the emergency room much lower, then that's going to make it a lot easier to incorporate people back into society, knowing that it's not likely to overwhelm our system if we've got something that can mitigate or lower the risk of serious illness. So nothing firm for you today, but at least some places are still completely overwhelmed, but we're not adding new cases as fast, so our flattened peak is hopefully on the good side or close to it. All right, so I talked about the fear mitigating stuff, and we're getting to the place where even though we still need to stay in so we don't overwhelm our emergency rooms, we're probably most communities now, if we keep going the way we're going, we're not going to be New York. We're not going to have a whole room full of people gasping and dying who can't be put on ventilators. So that is at least hopeful for fear. All right, so now the focus. So today's focus is a website that allows you to download a different adult coloring book design for every day of the month. And the website is supermundane.com, and there's a couple backslashes and coloring pages thing, but they've got really cool designs, and if you are stuck at home and have a printer, nothing is as cool as doing some very beautiful coloring. So maybe not nothing, but it's still cool. So that's your focus thing for the day. I will say that one other idea that I've heard floated around is that without too much time in the future, that our state stockpiles could actually be rooms full of 3D printers. And so the way that we provide what we need is to have every state have 3D printers and to have a national repository of different designs for what we need, so people can print what they need in the way of plastic or in the way of masks or lots of different things. So I cannot see how that's not going to happen. That makes so much sense. That will probably be part of our stockpile going forward. All right, so now I'm going to talk about pain management. And this part of pain management is something called acceptance and commitment therapy. And what that is if you find that you are at home and it's hard not to concentrate on your pain, instead think about some of the things around the house that you enjoy doing or some of the things that you need to do, and rather than concentrating on your pain, instead concentrate on achieving a few things that you want to do. So this requires having a period of time that you're not in that much pain so that you can set up your goals and figure out what you would like to accomplish. But they have found that over 6-month periods of time, compared to gabapentin, medications, traditional ways of dealing with pain, people that did acceptance and commitment therapy just decided to suck it up. You're going to have some pain. You can't do anything about it. But instead, what you do is focus on what you want to achieve. So acceptance and commitment therapy in quarantine may mean that you decide you're going to print out one coloring page for each day and do one. It may mean that you decide you're going to have 3 FaceTime or video calls or even just analog telephone calls with someone a day. But to decrease pain, establishing what you want to accomplish and then moving forward and doing it and focusing on that as your metric of success for the day, over time it actually reduces pain. So there we go. So for decreasing fear, we have the fact that we've got 75 trials of treatments that are underway. For decreasing pain, we've got acceptance and commitment therapy. And for your focus, we've got printing out adult coloring birth things. Do I have a question?
Yeah, you have a comment from Dan Miller. He's looking for an alternative to opioids that a doctor prescribed. He suffers from a vascular necrosis and have had knees, hips, and shoulders replaced.
So it sounds like you're looking for a medication that will help. So the problem with pain is that there are not a whole lot of really good medications that help for a long period of time, because medications end up, your body accommodates for them and ends up responding to it to try to overcome the effect of it. So we certainly on our website, you can get the more up-to-date version of what works for pain. Ta-da! For if it's an avascular necrosis and some of the pain comes from not having blood flow, if it's a claudication thing, vibration is really good at increasing blood flow. So at really high frequencies. So I would go ahead and try a VibraCool if you haven't for that. From a medication standpoint, though, there are a number of things that you want to decrease some of the inflammation. So magnesium is going to be a good one there, and that one's about 250 to 500 milligrams twice a day until you start feeling effects, and it's going to take about 3 days for that, so stick with it. There are a number of different herbs. Boswellia is one. Most of them are all related to inflammation. The problem, of course, with avascular necrosis or any kind of a bony pain is that usually the nerve endings are getting jarred and there's not a lot of inflammation. It's just bone on nerve, or it's just nerve pathology. So for that's where it's really helpful to try to do things like acceptance and commitment therapy to figure out heat and cold. One of the nice ways that we talked about a couple times ago is that it turns out that if you put heat on for about 5 minutes and then put cold on for 20, you get a much more prolonged desensitization of the nerves. Usually with bony things and with avascular things, cold is unpleasant, but I would at least give a try at putting a hot pack on an area first for 5 minutes and then putting a cold pack on for 20 and seeing what happens with that. So really, pain management, especially when the etiology is going to be with you, is all about keeping a diary, trying different things, looking at the best ways to distract yourself, finding things that can be even mitigating the pain a little bit. Because if you get one thing that takes it down 30% and another that takes it down 20 and another that takes it down